I'm Katja Iversen, the head of Women Deliver, a leading global advocate for gender equality and the health and rights of girls and women. Despite significant progress in many development sectors, health inequities persist in the Western Pacific region. Differing gender norms and roles influence the varying health impacts, risk factors, and access to services. So I am thrilled with the new regional director's commitment to gender inclusion and to gender equality, and of course to greater creativity, more innovation, and stronger partnership, as you mentioned in the white paper. And I'm excited to participate in WHO Western Pacific Region's Partner Forum and to bring a gender lens to your proceedings. Women Deliver serves as an advisor on health and gender equality for governments, companies, and organizations. And right now I'm President Macron's G7 Gender Equality Council. And we bring the same evidence and the same message. A gender equal world is healthier, wealthier, more productive, and more peaceful. I have 3 messages for you as you go into this forum and beyond. We need to look at health through a gender lens if we want to achieve health for all and get universal health coverage. The gender lens must be applied to the design and delivery of the whole healthcare system to reflect how girls and women access, experience, and often deliver care throughout their lives. And 3, listen, learn, and involve the frontline workers, young people, the women-focused organization, and the most vulnerable. As we all know, if we only treat health as a standalone issue, we will never solve the challenges. The health of a person is affected by education, poverty, nutrition, status in society, and other issues, just as a person's health status affects these things. A key determinant for health and for the achievement of the Sustainable Development Goals is the status of girls and women in society and gender equality. Access to healthcare, not least sexual and reproductive health, saves lives and is a bedrock of gender equality. It provides girls and women the opportunity to decide on their own reproductive lives, get an education, and participate in the economic and political aspects of their communities and countries. Evidence shows that when we invest in girls and women's health, rights, and well-being, everybody wins. In fact, a gender lens is required to effectively address all the priority issues for your region. Aging and communicable diseases, health security, including antimicrobial resistance, climate change and the environment, and of course the unfinished business on infectious diseases and not least maternal health. It is heartening to see that Dr. Kasai and WHO in general have strongly committed themselves to addressing gender and health inequities as part of the global program of work, making it everybody's business. Because we have partnership in our DNA at Women Deliver, we also appreciate Dr. Kasai's open and transparent process setting the WHO agenda in the region. Speaking about partnership, I urge you to always include the people on the front line, the women-focused organizations, the women-led organizations, both those working at the global level and the local organizations that most often don't have a seat at the table. And don't make the mistake of leaving out the experience and the ideas of young people. If you want your plans to work, you need to listen, learn, lift, and include them into all the policy making, strategy design, budget negotiations, and implementations. It's important to get together physically once in a while. In fact, that's why we just brought more than 8,000 change makers together in Vancouver for the Women Deliver 2019 conference to instigate, co-create, collaborate, and map that way forward to a more gender equal and healthy world. But a lot of wonderful things can be achieved through online meetings, consultations, and forums, just like this one. I challenge you to meet new people through this process and to dig into new ideas and solutions. And I encourage you to approach this partner forum as we did the Women Deliver conference through the lens of power. How can we tap our individual power to make change? How can we dismantle and overcome the systemic and structural barriers standing in the way of success? It will be a big task to make the Western Pacific region the healthiest and safest in the world. But I'm sure you can do it with a good plan, good partners, and that much needed gender lens. Good luck and have a great forum.